This is the final presentation for Sarah Morrison, the Graduated Driver Licensing Decal Laws. First, we're going to start with the purpose. The purpose of the evidence-based program was to gather statistics and reports of vehicle crashes within the state of New Jersey on adolescent drivers under 21 years of age. These drivers are referred to in this program as probationary drivers, also known as Graduated Driver's Learners, or GDL, within the context of this evidence-based program and slideshow. Let's take a look at the target population. The target population for this evidence-based program consists of New Jersey's teen probationary drivers, GDL, and the state of New Jersey's law enforcement. Let's look at the design and outcomes. The study design consisted of examining the effect of New Jersey's decal law on the monthly rate of citations issued to probationary drivers for violation of a GDL restriction, and also police-reported crashes among New Jersey's probationary teen drivers during the first year of the law's implementation. Secondary crash outcome measures included injury, nighttime, single vehicle, multi-vehicle, and peer passenger crashes. Concurrently, the study purpose focuses on estimation of the number of probationary drivers for whom a crash was prevented by the decal law. However, the effectiveness of current laws has been limited by the inability of police officers to enforce them. Thus, the potential for GDL laws have an even greater impact on reducing crashes correlates with efforts to enhance police enforcement of these restrictions. When looking at social factors, we should identify key investigative questions, examine psychosocial influences, and social factors, which are key factors more likely to affect the rate of crashes among adolescent drivers. Studies estimate a correlation between probationary drivers for whom a vehicular crash was prevented. This is through implementation of the decal law, also known as Kiley's Law, effective within the state of New Jersey in May 2010. Let's look at some health factors. Determinants of health factors surround the target audience through Schneider's discussion on how public health has a mission to protect the population from disease and injury. This is equally important. Arguments and experiences collected require the teenage brain to form risk assessments and risk perception in regards to operating a vehicle safely. The social aspects of the articles discussed include youth, teenagers, health, accident prevention, and risk assessments through implementation of Kiley's Law. There's also been change in the community, which was promoted through implementation of Kiley's Law. The law was enacted in April 2009 and made effective May 1, 2010, thus requiring the government to weigh risks associated with the outcome of the evidence against expected benefits. Focusing on license phase and restrictions, research outcomes were provided to help guide ongoing policy debates within a national and international level, as policymakers consider adding a decal to enhance existing GDL laws. Let's discuss some of the key players in the development of the GDL program. Let's take a look at external stakeholders. The population of residents in the state of New Jersey, including graduated driver's licensing decal drivers and full privilege drivers, all benefit greatly from the information and data gathered. This information has the most influence on the long-term success of the graduated driver's licensing decal laws. Taking a look at stakeholders that benefit on a national level, we see the NHTSA, the CDC, the Consumer Product Safety Commission, OSHA, the Years of Potential Life Lost program, the Graduated Driver's Licensing Decal program, Congress, the Center for Injury Prevention and Research. Breaking things down on a state level, we can see those affected as a stakeholder would be the Public Health Law Research Program, New Jersey's Department of Public Health and Policy, New Jersey's Graduated Driver's Licensing Program, the Department of Criminal Justice, the Department of Transportation, the Department of Motor Vehicle Commission, state legislation, as well all as New Jersey's Office of Information and Technology. And finally, on a local community level, it's important to consider all the external stakeholders within the community. Each of these key players also may hold a piece to the program and aftermath of the information. This includes the Children's Hospital of Philadelphia, Kiley's Law, the State of New Jersey Criminal Justice Program, and the New Jersey Coroner. Let's take a look at some more community resources. New Jersey became the first state to enact a vehicle decal requirement for young drivers by passing Kiley's Law, which became effective May 1st of 2010. This decal placement is utilized in a way to decrease vehicular crashes and fatalities. Under Kiley's Law, a red decal sticker is placed upon the license plate to act as an easily identifiable signal for other drivers within the community and serve as a safety precaution for parents with children on a probationary license. Police department officers can enhance enforcement of GDL restrictions through a simple pullover and/or citation of the driver with one of these red decals. Let's take a look at funding opportunities. This study was funded by a grant from Robert Wood Johnson Foundation, presented to the Children's Hospital of Philadelphia as part of their public law research program. No financial disclosures were reported. Let's look at additional funding. Additional funding opportunities for graduated driver's license and decal law may be possible through the following resources. NIH offers funded studies on night driving, teen passengers, and further reducing death. The Federal and State Highway Vehicle Safety Associations, the U.S. Department of Transportation, vehicle manufacturers, insurance carrier companies, and private grants are all possibilities. Let's wrap up with the delivery and conclusion of this presentation. Let's take a look at marketing. Community public health programs combined with police enforcement and policy prevention are ideal for marketing to teenage drivers. There are already vehicle safety campaigns out there such as Click It or Ticket or Live at 25. These billboards are media messages. They highlight these campaigns. Teenage drivers are involved in fatal crashes as more at double the rate of the rest of the population per 100,000 licensed drivers. Three basic types of audiences can be targeted into public health campaigns. One, messages should be aimed at whom expected behaviors should be changed, such in this case as teen drivers. Two, let's target the individuals who are in the position to influence the intended audience. And three, aim policymakers responsible for creating opportunities to shape individual health decisions. Creating a safety campaign which utilizes diverse intensive appeals creates community awareness through utilizing positive centered appeals tied directly to policymakers, which create an opportunity for possible buy-ins from vehicle manufacturers and insurance companies looking to market their brands, celebrity endorsements, and rewards for safe driving. Successful programs utilize all areas of resources within the community. In the Graduated Teen Driver's Licensing Program, an entity of a grant resource was the Robert Wood Foundation through a partnership with the Children's Hospital of Philadelphia. Looking at the role that public health played, the state of New Jersey implemented assistance from several public health divisions. There was a clear coordination between those public health divisions and the National Highway Traffic Safety Administration. Additionally, in-depth statistics required were accessible through the New Jersey Motor Vehicle Commission's licensing and registration database. Cooperation between the New Jersey Police Department, policymakers, implementation of Kiley's Law also made this study possible and effective. Short-term effects of self-efficacy and the ecological model is seen throughout the partnerships between the police department and GDL drivers. As the GDL saw a possible threat to driving without the decal, a rapid increase in the GDL citations were issued by the police department as a belief in response efficacy. Further, at the time Kiley's Law was signed, there was a 9% reduction of police-reported crashes post-law implementation, a 14% increase in the rate of GDL-related citations issued, 1,624 estimated probationary drivers for whom crashes were prevented, quality of life had been raised through less deaths, showing remarkable community interaction through personal efficacy and belief that new behaviors are consistent with group norms. Looking at long-term effects, the most effective public health intervention programs influence people's beliefs at several levels, with the goal of creating a social environment favorable to healthy behavior. Thus, the program should continue to focus on both the social and physical environment of the drivers. Policymakers were able to see a clear correlation between the effects of Kiley's Law and the GDL decal in place through long-term statistics, continually noting decreases for single vehicle crashes. All U.S. states now have GDL restrictions in place. Awareness of the decal citations post-law increased 95%. Policymakers have a valid and interpretable study to utilize for further programming. Quality of life is increased through the reduction of crashes. Let's finalize scalability of the program. Given the resources required to implement and sustain this study, the scalability and adaptation into existing programs for broader implementation is indeed possible. Because health is so strongly affected by behavior, it is important for public health advocates to understand what influences people to behave in healthy or unhealthy ways. Finally, according to Teen Driving Source, all U.S. states and 5 countries have some sort of GDL test. Allowances must be made for flexibility in changing course when appropriate. Results and their measurements matter. States with comprehensive GDL programs in place report as much as a 40% drop in the number of fatal crashes among 16-year-old drivers. Although 3 components of GDL separately contribute to reduced crash rate: extended learner permit period, nighttime driving restrictions, and passenger restrictions. GDL programs that combine all 3 may result in the highest crash reductions among 17 and 16-year-old drivers. Thank you for your time.